Well, thank you all so much. I see people out here I've known for a long time that have even raised me, like Dr. Mary Jane Hamilton. I was 18 years old when I did my clinicals with her and Liz Sefcik. And then Chris Bray was my teacher, and then I became a colleague with her, and I taught out at A&M for a while. And people like Christy Day and Amy Thornberry and Patrick. I got a goita?
You got it.
I got it. Boom. Okay. I want to thank them because they really inspired me in nursing. And I worked nights in ICU, took a couple of years off like many of us did. Then we went back. Del Mar was a great program, still is. And went back and got my bachelor's degree back when dinosaurs roamed the earth, and it was CCSU. I was the last graduating class there. I'll show my age. And then I met my wife there, Priscilla. She couldn't be here today. She had a procedure. Without violating HIPAA, she's doing okay. But Mary Jane taught her too, and so did Liz, and so did Beverly Leach, and on. All the great teachers that you don't learn about nursing just through a book. You do it. You go out there and learn. You take care of patients. And the lucky few of us that have become nurse practitioners, we stand at the helm right now at a great time. When I got out, nurse practitioners got about $2 more an hour. Well, I got 50-cent raise when I got my BSN. And then I got maybe a $3 or $4 raise when I became a nurse practitioner. And now it's a whole different ballgame because insurance companies, because leadership, and everyone out there recognize the value of what we are doing. So give you yourselves a big round of applause. Part of what I do is, and it kind of dovetails into everything, they said, Joe, you're all over the map. You do politics, you do law, but it all works together. That's what I tell my wife. But it's a lot of work, but it's a lot of fun. I represent nurses and doctors and other healthcare professionals, and I like what I do. But I also represent, and the people from River City Hospice, I want you all to stand up. Those representing River City Hospice, give them a round of applause because 4 years ago, I allied myself with River City Hospice for a reason that, my dad got sick. I was a caregiver to my father for a very long time. I wish I had known more about hospice. To me, hospice, even as a master's prepared nurse, was, well, you get cancer, you get sick, you get hospice, and you die your last few days on hospice. And that's just not what it is. They're making great, nobody teaches you how to be born. And they celebrate birth, but a lot of times bringing family together through hospice, it's a beautiful thing too. So working in ICU for many years, and then working in gerontology, and I've seen the lifespan. And I've seen what a wonderful company River City is. So nurse practitioners out there, get educated on it. Give me a call anytime, email me. I'll be glad to go out there. And any of these lovely people here from River City Hospice will give a great presentation on it. Because it's just not about cancer, that's about a quarter of the diagnoses. Most of the diagnoses also the underdiagnosed, the caregivers that take care of these people with Alzheimer's, with end-stage dementia, with heart disease, with lung disease, with the growing problem and epidemic that my dad had, renal disease. These are the great and special people that get out there, from clergy to nurses to nurse practitioners. This is what matters. So I'm proud to be here on behalf of them and on behalf of myself. But the most important thing I wanted to do, and I always get this, I'm a lawyer, so they say hurry up. The judges say you love to hear yourselves talk. So I always say 5 minutes max, But what I want to say is that the proud thing that I think about that impresses me is how far we have come. Nurse practitioners now are up there. We have a great legislative team. We've got people out there like Aaron Cusick and everybody else that's out there in Austin. After SB 406, it's a watershed moment for us where we are making those strides and getting there, that autonomy that we seek. We're not trying to be a doctor. We need to educate the people that nurse practitioners are special. We're not medical doctors, but we are healers, and we care, and we also cure. And that's what matters about nurse practitioners. Each of you out there, whether you're a nurse practitioner, a nurse, or a family member that helped get them through, many nights and many clinical hours. I just want to say thank you for being here, because these people at these tables are what it's all about. And getting out there, each and every one of us is an ambassador, telling everybody about what nurse practitioners do, how we care. And those nursing students back there, I was talking to a couple there in the table, very proud to see a new generation, because nursing, people are aging that are nurses, and we need people to replace us. You know, I was at a time that I was the youngest in a code. Now I need these 30 years later. So going to be 48 in December, and a lot of time has gone by, but I really enjoyed my time. I still practice as an RN through hospice, through River City, and it's an honor to work with them. And I'm going to go talk to some nurses tomorrow. But I want to let you all know that I couldn't ask for a better organization than Coastal APN to work with. They are something right here in South Texas we couldn't need more. At a time when diabetes is rampant, at a time when we're #1 in amputations and renal disease, we need nurse practitioners out there in the rural areas and here in the underserved areas. We are the brick and mortar that the healthcare field needs, and we need to support that. And doctors are coming around and saying, yeah, I need, and insurance companies especially, are starting to come around and saying we need nurse practitioners, because a $150 house call is better than a $15,000 ER visit any day. So I want to thank you all for coming, and most lawyers talk too much, so I know when to shut up. I better sit down. And again, very proud of being here today. Thank you.